Hey guys, it's Jen. I hope you're all doing well. Video number 4 of the iFitNurse Pearls is going to discuss medication errors, what to look out for, when they're most commonly made, and anything else that I have observed either me personally doing or a student or another nurse that can help you avoid. So that is the number 1 error that nurses can make, is a medication error. I absolutely understand the fear that you have when making it, so I want to help you identify the most common moments in our day that we can make a medication error. So I hope you get something out of it. I'll let you know about an instance that happened that I personally caught a medication error. So I want to just encourage you. I know it is scary, especially if you just got your new license and you're just starting to work on making a medication. And as a nursing student, I want you to know, and that's why I know it's tedious, but we want you to make sure you know how to do patient identification using 2 identifiers, if not how else to go about that. And then the medications, what are they used for? Are they appropriate? Are there any signs and symptoms that you need to look for that would cause you not to give the medication? And even like administration, but I won't go into that one because that's probably a separate video. But medication errors. So first things first is obviously not reading the medication label and not getting the medication that is for the patient. So whether that be that you haven't identified the patient correctly, if their armband doesn't match with the medication or their profile, or you override that entire scanning process. It depends on the facility if you have that or not. And you don't want to give obviously the wrong medication to the wrong patient, or even the right medication to the wrong patient. So let's say, for instance, Bactroban. So it's mupirocin. It's an ointment, so like an antibiotic ointment that you put in the nares for MRSA. So it could be, I don't want to say it's a routine drug in the ICU, but you know, almost everyone is on it, but just depending on what's going on with them. Let's say there was a patient there and there was in the bin, and you go ahead and grab it, and it had the other patient's sticker, while you got a new patient that's going to obviously be on the same medication. You do not want to administer the tube of medicine that had the previous patient's sticker to that patient. Yes, it should have been cleaned out, but if you don't look and make sure there is a label that matches your patient, that's a medication error. For instance, let's say insulin, long-acting insulin is drawn up by pharmacy, then they go ahead and bring it to your unit. At that right moment, a medication error could occur if you're scanning, you scan it, and everything lines up. But then you look at the syringe, and let's say during the transport of the medication, something bumped into it and the plunger expelled some of the medication and you're not giving a full dose. That's a medication error. You're not giving the prescribed dose. Or even if you're co-signing a medication, yeah, you will get to know your nurses, your buddies, and all of that. You will trust, you would hang out, you could be best friends. I don't care. I want you to look at the patient, the band, make sure it's on their profile, and make sure it's the units that you're co-signing for. I can't tell you how many times I've walked in and I have co-signed and I look, I want to see the syringe. I want to see how many units you're going to administer, and if it matches up with what you're saying, 1, and then what's being documented, 2. There was a case scenario, like I mentioned earlier, where they had the wrong amount of units on the insulin syringe. That's a medication error. And let's say if it was more than what was prescribed, then I would call the pharmacist and tell them, hey, so I just got the medication from the pharmacy technician and you guys drew it 10 times the dose that was required. That's a medication error. And you have to go through this whole, like, obviously documenting and reporting just to make sure that they are looking into it. You don't want those mistakes to happen because they could be even fatal to your patient. In the ICU, let's see, administering medications through, let's say, an NG tube, a PEG tube that are not supposed to be crushed. You're not supposed to crush certain medications. You're not supposed to stab a capsule to put it into that. So at that moment, I want you to go to your physician or your pharmacist, hey, is there an alternative for this medication? And if not, say I cannot administer this medication because the route is not available. So let's see, I'm trying to think of other common areas where you can make a medication error. Okay, so let's say a patient's on a heparin drip. You'll obviously make changes regarding the patient's like PTT that comes back. So medication error could occur if you are looking at the wrong lab from, let's say, 6 hours prior to that, not the one that just came back. And then if you make any changes to the drip, you're not making it to what the person's last lab work showed. That's a medication error. Administering medications at the wrong time. So I believe I've caught myself pulling, let's say, pain medication. Let's say it's Norco and it's Q6, and I pulled it when it was only the 5th hour. So I was an hour early. Actually, that's not a good example. Let's say 2 hours early, because I could probably do an hour. No, I can't. See? Medication caught. Error caught. So, for instance, let's say I gave Norco at 9 a.m. and then the next dose is at 3 p.m. It's a medication that's probably ordered to be given every 6 hours. Medication error could have occurred if I pulled it at 2 p.m. It's not a scheduled med, so you can't fall into the give an hour before, give an hour later. No, it's prescribed every 6 hours. So the earliest I can give it is 3 p.m. So administering it at the wrong time, that's a medication error. Let's see what else I can help y'all with. Just even pulling medications from the Pyxis. There are a lot of boxes. I want you to double check. So what I do is obviously look at my patient's profile. Make sure you're choosing your patient. Because let's say if they are aspirin, let's say 81 milligram aspirin, and then patient profile, let's say the patient right next to them are on 325 or something. So if I'm on the wrong patient's profile and I knew I was going to the Pyxis to get aspirin, I click, okay, aspirin, click, quantity of 1, pull the aspirin, and I pulled the 325, and I'm going to get to, that's an error if I proceed and I don't use the steps that are there to keep the patient safe. So let's say, oh, I'll scan it later. Don't ever scan it later. Go ahead and log in, do your patient identification, identifiers, make sure everything matches. And I'm hoping that at that point you would be like, oh, it's supposed to be, aspirin 81, not this one. You know what I'm saying? So things like that will happen. So I don't want you to feel like, okay, if they happen, I'm totally dumb or anything like that. They will happen. You just will get better. And I'm hoping you will just stay totally motivated and focused to make sure that you catch those medication errors. For instance, a telephone order. Sometimes you can't understand either due to poor connection. I feel like every single time I talk to a doctor, they're under a tunnel. Or in an elevator. I just can't make it out. Even like certain accents, they're difficult to take over the phone. And even taking the telephone order and putting in the computer, if it's not what the doctor wanted, that's a medication error. You have put in their incorrect order, and then you probably administered something that was supposed to be Q4 hours, and then you ended up putting Q2 hours because that's what you thought you heard. Also, I have found myself in a position where a physician will come by and tell me, hey, I'm going to give X, Y, and Z, and they end up putting something totally different. Like, that's not what I was expecting. I don't understand the indication why this patient would need that medication. And that's when you as a nurse, you're thinking about your patient, their overall picture. Why does this person need this medication? This does not make sense. And I've caught myself doing that many times. And I'll even go to the pharmacist, hey, so for instance, one of the last scenarios was Lovenox. And it was, I think, like 140 milligram dose, I think it was. And I'm like, whoa, that's like a lot. I know it's weight-based and all of that, but I'm like, the numbers just don't seem to add up to what I am like calculating. So I go and talk to the pharmacist, hey, so can you help me figure out, is this an appropriate dose for my patient? Then we started looking in, well, that's the weight that's on the computer. I'm like, yeah, no, that's not accurate. Let me go reweigh the patient. That's another step, that's another walk or whatever, but you're putting your patient first. So I went ahead and obviously looked at what the weight that was charted, the weight that was charted before, and then I reweighed the patient, looked at that, and yes, we were about, I don't even know, maybe 20 to 40 pounds off from what the prescriber was using to dose that medicine. So that could have been a medication error. You want to make sure that you're just thinking about the entire patient and not just getting into the routine, oh, it's an order, the physician put it in, the pharmacist approved it, so let me just give it. Now, and at that point it was already verified and everything, so I was getting ready to pull it out, and I'm like, and you start developing that feeling, you know, that level of critical thinking that you're like, this does not make sense. And sometimes I'll even bring something up and maybe I just had a misunderstanding of it and it was correct. I'm like, oh, okay, at least I felt better. So I could have easily just said, hey, the pharmacist, the physician has, you know, approved it all. I'm just gonna give it. No, if you ever have questions, go ahead and ask. You are doing a great job by doing that. This is just a side note. If any patients or family members come in with bottles and bottles of their medications, I want you to tell them, you know, may I take the medicines? I want to make sure it's on the profile, that there's not anything that we're missing. And I couldn't tell you how many times I've gotten a patient and I'm doing their medication reconciliation on their chart and I see the same medication or like 3 different bottles of the same medication, maybe slight changes in doses, and they're telling me that they're taking all of that. So they could be taking medications like twice the dose that they need. And at that point, you know, you want to clarify, please don't, you know, take this home. Do not give them anything while they're in the hospital. We'll take over everything. Physicians will choose when to restart certain medications, and that will help you prevent other medications of either, you know, administering 2 doses. Let's see. Okay, medication errors as well. I will probably expand on this. It's, let's say, I want you to think about 2 things. So for amiodarone, you do need a filter on there to safely administer that medication. So that's using the supplies that are indicated for that certain medication. Even if it's the same, even if it's the right medication, I want to just put that in your head that you need to obviously give the correct medication, but use the correct supplies. That is there for safety reasons. And let's say for a patient that, all right, so next is, let's say, talking about titrating drugs. That is probably a video on its own, but I will recommend that you do these steps to help you get comfortable with these titrating drips. In the beginning of the day, obviously jot down where the patient is on all of the titrating drips, jot down the orders for it, you know, how often, what's the dosing that you can titrate up to, and then how frequent you can do that. So, and then have a list, so whenever you're taking care of that patient, you don't have to open the computer every single time to quickly make a change on the pump. That will definitely help, because if you, medication error, let's say if they are on a vasopressor like Levophed, if their blood pressure is going up, you should come down on your Levophed drip. So I'm not gonna get too specific on that, but let's say the blood pressure is going up and you go up on the medicine, that's a medication error. You're not using the order correctly. And instead of decreasing the dose, you're increasing the dose. Does that make sense? So I found that in the beginning to be very overwhelming. When I would walk in, this patient's like on 3 titrating drips. I want you to write that down so you know. You can quickly glance, okay, Levophed is for blood pressure management. I have to keep the MAP above, let's say, 65. And then that's why you're there, to assess and monitor and then titrate that drug. If the patient is, they're becoming more dynamically stable and you're not requiring that much of the medication, start making those changes per the order. And that's also another medication error. It could be titrating twice the amount that is ordered. So instead of going down by 2.5, you're going down by 5. So I hope it's long video, I'm sorry about that, and these are probably just a few that I can think of on the top of my head. There's so many. Just to recap, make sure you're obviously scanning and working with the correct patient, that the medications match, that the dosages match, that they are being properly administered, you know, with the correct supplies, that you're always checking lab work to make sure that if it's still indicated or not. And obviously look at the side effects or any other signs and symptoms that you need to be aware of whenever you're giving certain medications. So I hope you got something out of it. I'm sure I probably will do another one to expand on all the things that I've missed, because there's just so many opportunities for you to make any medication errors, and I want you to catch them. I want you to catch them for your patient, for their safety, okay? Never feel like you can't ask a question. I've called the pharmacist many times. I've even gone to the pharmacist's office on our unit and just had that one-on-one conversation to clarify certain things. So I hope you got something out of this video. If you have any questions, leave in the comment section below. Don't forget to comment, like, and subscribe, and share the videos. Bye.